Sure, we really embarked on an emphasis on quality of care a good probably 6 years ago, understanding the new ROPs coming into effect, understanding what our payer sources were asking for and value-based purchasing, and understanding we knew that we had to increase and maintain our quality of care to be significant and relevant in the marketplace. We've restructured what was a typical mock survey into a 365 CQI, which is continuous quality improvement, structured really much after an acute care model where you're ready for survey anytime. You should really have that quality of care going 365 days a year instead of those periods of time 3 months before and 3 months after. So that's one of the things that we've done. We've also, because of our EHR and the transparency of which that provides us, we developed a new program and a new position called documentation specialist. So my documentation specialists from a clinical and reimbursement perspective are able to look at process breaks and process improvement through the EHR and through the processes that we are able to develop at having an electronic health record.
How difficult was it to get everybody on board? I mean, did you have to go through some culture change or just pure education of staff?
Absolutely, but I did find that it wasn't as difficult as we had thought it was going to be. And mindful that we're still on that journey and continuing on that journey with structured performance improvement projects, but the journey of changing the culture, it's taken a good 2 years, I would say, but now everyone is seeing the benefit, they're seeing the outcomes. We had 18 months with no significant survey activity in our annual surveys given that, and as they see that, they understand how beneficial all of those programs have been for them, and we're helping improve their quality and helping them improve their outcomes, and we've really been able to show that through the outcomes. We do. I was brought on about 8 years ago, and my expertise coming from a ICU setting, so very high subacute in the West Coast, developed a lot of high acuity skilled programming. So we do a lot of, cardiac, pulmonary, did some specialized programming around pulmonary COPD, cardiac heart failure, and introducing the effects of comorbidities, since everyone has comorbidities these days, on those chronic diseases, and also implementing chronic care management and self-management from families and families and residents themselves. This has been a great symposium as we, as a company, look to the future and look to how we want to develop and go forward. These alternative payment systems and understanding where the industry is going and why it's going there is extremely important. So hearing things from Mark Parkinson and all the leaders is very important to hear how the ISNPs, the ACOs, all of these things are going to be relevant, and so it really helps me understand that we're looking to the future in the right road as we continue on down here and formulate some of these relationships in the marketplace that we exist.